as we get older, the prostate continues to enlarge. That process is called benign prostatic hypertrophy, otherwise known as BPH. The prostate surrounds the urethra, and that's the tube that carries urine from the bladder through the prostate out of the body. And as the prostate enlarges, it squeezes on the urethra, restricting the flow. So men get symptoms such as reduced flow, stopping and starting of urine, the need to rush to the toilet, and that sensation of not fully emptying your bladder after you've gone to urinate. And let's not forget straining to pass urine and getting up at night. And in very severe occasions, patients are unable to pass urine altogether. And that's when we often have to look at surgical procedures in order to get men urinating normally again. So one of the procedures I specialise in is called holmium laser enucleation of the prostate, otherwise known as HoLEP. HoLEP is one of the most advanced surgical procedures that we use for the treatment of men with enlarged prostates. It can provide effective and long-term durability in terms of the improvement of urinary symptoms for men, and at the same time minimising the potential pitfalls or complications associated with more traditional prostate procedures. The way it works is that we use the laser fibre to peel the prostate away from its capsule. So imagine the prostate is an orange, and what we do is simply go through the layer between the fruit and the skin and peel the entire prostate away, leaving just the skin of the fruit behind, the prostate capsule. This is what makes it so effective and of course so durable, because there's minimal, if to no tissue left behind that can potentially grow back and cause recurrence of urinary symptoms. The benefit of performing the HoLEP procedure rather than removing the whole prostate in its entirety is the fact that it remains minimally invasive through this approach. By leaving the capsule of the prostate behind, we're able to maintain that conduit for urine to flow easily, which drastically minimises any risks of side effects such as urinary incontinence. The reason we perform the HoLEP with this approach is that it remains minimally invasive, compared, say, to patients who have to have their whole prostate removed for prostate cancer. This way, patients are able to maintain excellent rates of functional outcomes, such as urinary continence. HoLEP is so effective and safe because of the way that we're able to apply the laser energy. We're able to do that with incredible precision and accuracy, and at the same time seal blood vessels as we go through the case. This makes things like bleeding much less compared to other more traditional surgical techniques. Furthermore, the energy that we're using during the procedure is readily absorbed, which means that it doesn't impact surrounding tissues, which what makes it really safe. And in fact, it's this combination of safety and efficacy that makes it an option for men, even men on blood thinning medication, for the treatment of their enlarged prostates. One of the main advantages of the HoLEP procedure is that we can treat prostates of almost any size. It is a minimally invasive technique, and patients spend at most a night in hospital and often have their catheters out the same day due to the minimal amount of bleeding that's encountered. Our aim is always to get patients home catheter free. Also, because of the amount of tissue that's removed, often over 90% of tissue, it makes it durable, such that patients having to need another operation over the next 10 years is down to 1%, compared to 10 to 50% with other of the more traditional techniques. It's normal to experience a mild burning when you pass urine after the procedure, as well as some blood-stained urine for the first week or two. Generally, I advise that patients are usually back to normal activities within a few days, but definitely avoid doing anything strenuous for the first 2 to 3 weeks. The most common side effect is something called retrograde ejaculation, and that's at orgasm semen shoots backwards into the bladder rather than out through the penis. This doesn't affect sexual pleasure or erections, but it's something men should understand before undergoing surgery. In terms of serious complications following HoLEP surgeries, these are very uncommon, especially if performed by an experienced HoLEP surgeon. So to conclude, HoLEP has transformed the way that we treat BPH and is now widely regarded as a gold standard approach to men with enlarged prostate. It combines cutting-edge laser technology with excellent durable long-term outcomes, minimal bleeding, rapid recovery, and the ability to treat prostates of all sizes. So if you have bothersome urinary symptoms or indeed have an enlarged prostate, it's certainly worth discussing whether HoLEP is the right option for you.